Mr. Penley? Dr. Raimundo?
What was that one?
Dr. Raimundo, many times. Mr. West and Mr. Cash. And then we are expecting, oh, and I see Ms. Polite is logged on now too. We had the same to take temperatures in the morning. Have this many students, brick and mortar, come on campus, which we're required to do. Part of the safety measures that we put in place is to take, we're not asking for them to now become full-time clinic or healthcare workers. What we're asking is a rotation basis, or if one wants to do it, however you want to work that out, where they're part of the team, helps to take temperatures in the morning as part of the pandemic safety plan.
So again, we're not going to agree to that. And I think we could have a conversation about really truly the requirement to report back brick and mortar. We're returning face to face, but when it's safe. And so I just don't.
Elizabeth, can I just say really quickly, because I hear what you're saying and I appreciate it. And I don't know, I was hoping we could have a conversation about it, not just say no, but at the same time, I want to be very, very clear that we're here for a plan that has been approved by the board, approved by the Board of Education, which does not include everybody staying home. So I can't entertain or talk about, well, let's just all stay home and go live, no matter what my personal feelings or any other feelings are. But we're here to talk about how this plan that was written with 3 options.
And I appreciate that. And everything that you said is accurate. The plan was written with 3 options. The plan has been approved by the board. The plan option 2, VOL, has been approved by DOE. But what we've already identified and discussed is that the plan was not written for the employees. The plan was written for the parents and the students. So now, even with these approvals, the fact is that we have to bargain the impacts. And if this is impacting our clerical personnel, and now they're being asked to do something that is outside of their roles and responsibilities as articulated on their job, we're going to say that's not acceptable. And do not feel under any circumstances that refusing or saying I'm not comfortable with taking temperatures is not being a part of the team. Part of the team is you work your area of strength. These are clerical folks. These are not medical personnel. I understand the desire and the need to take temperatures as a screening measure, but it does not fall squarely in the lap of our support professionals. And so plan. And you mentioned not just saying no. Well, I could counter and say that to you when we've had not to you personally, Rachel, but to the district, when we have the conversation about providing paid admin, gotten pretty much hard nose on that, not using the word no, but budget constraints, and we've already spent the money and all this kind of stuff. So, that's the art of what we're doing right here at the table, trying to find a way in the parameters that we have. And I will just say squarely, OS folks are clerical. They should not be doing the temperature checking.
So is the union's position then, do we not take temperatures when students come in?
The union's position is that's outside of the roles and responsibilities of this staff. Needs to find another mechanism, and it doesn't need to be bargaining unit folks. I mean, you've got administrators on campus, and let's talk for a second about some of this CARES Act.
Wait, I'd rather just, can we stick with this? And because I'm hearing is where do we go from here? If this is, we have to have people, assign 1 or 2 administrators on campus available to help with taking temperatures. So aside from that, in order to take temperatures, in order to ensure there's nobody with a fever, it's going to require more. If we have, some schools have 1 principal, well, and that is, they don't have an AP.
Well,
so if that is a hard nope, they're not going to do it, then where we go from there.
Well, and that's something that has to be figured out, but the clerical with taking temperatures. What seems to be a trend is that some jobs just automatically roll to support staff, whether they are truly their designated responsibilities or not, it just roll that way. And in this moment in time, that cannot occur to support the process of running our schools. You do according to their job responsibilities. They can dispense medication when necessary to cover or help during an emergency in the clinic, but that's it. That is the extent of what is written in their role, in their, what is it?
I guess I'm not understanding.
Well, you know, Rachel, everything is a give and take, right? And so I can't give on this one. I can't give on this one. It's not equitable to our office specialists. It's not an equitable request to ask them to step outside of their responsibilities and, quite frankly, put themselves at risk. Are our office specialists any less valuable than an administrator or anybody else on the campus? I say no, and I know you would agree to that too. So I think there's got to be another mechanism that the district figures out. So I'm sorry, I'm not sorry, but that's our position.
Okay, so take a 5-minute caucus because we're going to have to discuss where we go. I think I know where our stance is, or I just want to verify with the people in the room, and because that may be one where we won't be able to agree. Can we take 5 minutes?
Certainly, you can take 5. I just would like to remind everyone that, you know, terms and conditions of work must be bargained. So I don't believe that there is a unilateral ability to just say, okay, we heard you, union, but we're going to do it anyway, because there will have to then take formal action. So let's work together to find we can manage so we don't have to go that route if possible.
That's what I'd like to do.
Okay.
But we're going to talk within, so 7:20 we'll be back.
Okay, that's fine. I'd like to go to the breakout room if we could, please. Oh, love it. I have to remember when I come back, it's muted. Challenging.
Hello, do we have everybody back?
I think so.
All right, thank you for that few minutes. I wanted to kind of regroup, talk with the team and see where we are as far as, especially with our school-based people, to see what was out there. And we also had a talk about terms and conditions, which I'm going to ask Mr. Penley to talk for just a minute as it relates to our discussion around terms and conditions was, and then hope we can bring it back to some problem solving. So I'm going to turn it over to him.
Thank you.
But that's not really working out. I don't know what's happening. Maybe, does Mr. Penley not have his own computer? I mean, I don't know if that's
I'm sitting in the room.
Your room needs to mute your computer
Mute?
while you're talking, or else it'll come. The feedback will continue.
What you learned, because your computer seems to be working.
Now we're on. All right. So the fundamental problem that we're dealing with here is trying to exigent circumstances pursuant to emergency orders and the governor's executive orders that require that we have schools open. So we're doing that with reasonable extensions of the current terms of conditions. We're perfectly willing to negotiate those terms, but no, and refusing to negotiate them is not appropriate under these circumstances.
So may I interrupt for a moment? We're not refusing to negotiate, but we're just
Saying
telling you
no
that
is
this,
refusing to
I'm
negotiate.
sorry, I'll let you finish then. My apologies.
No, saying no is refusing to negotiate.
That is not true. No is a position in bargaining.
And so I would also point out that as I read the emergency order from the, not mention anywhere that support staff have to work outside of the roles and responsibilities that are articulated in their job description.
Well, I also want to add that at no place has the any part of the collective bargaining agreement, Constitution, or in Chapter 447. So I am sorry that Volusia made this plan and then came to us. We kept the plan to come to us and work with us, and that did not happen. So here we are now playing catch up, and that it does pose problems.
Elizabeth, did you attend the planning sessions for this plan?
So I can tell you that we attended the sessions that occurred prior to June 23rd. Then there was a gap where there was no invitation to attend planning. After the plan was created as it's being tweaked, we were invited to attend, and I think it was 2 one-hour sessions where it was presented. Did not receive the plan in advance of the presentation, and then we were afforded another to look at what had been created. So if you're asking me, I sat in a Zoom meeting, I think the honest answer would be yes. If you're asking me if I was a collaborator in the creation of the plan, the answer is no.
Okay.
And I can
And
tell
that
you,
wasn't asking to put you on the spot. I wasn't part of all of those meetings either. I'm just asked because my understanding was that View was a part of meetings within the plan, was presented the plan before it was presented to the board, and there were conversations. I wasn't asking to put you on the spot. I was genuinely asking.
yes, and Rachel, your language is right. It was presented to us, but we were not afforded the opportunity to roll up our sleeves and sit shoulder to shoulder and say, let's work out something. As a matter of fact, I don't know if Mr. West is on the call this morning or not, but that we've been seeking to work on all of this for probably a month and a half, 2 months now. Here he is. And so we've been asking to participate in this. We've been in ongoing collaborative conversation because we knew that we were going to have some bumps in the road and we wanted to get ahead of them, but it did that. So here, like Tracy said, here we are trying to work out some of these kinks. And I guess the expectation somewhat is that we're just going to fall in line. And that's not, we talked a little bit yesterday about plans that administrators at school sites are working on plans right now, specific to what they're doing at their schools. And we're hearing from our folks that there are some egregious things being proposed. We talked about one last night when we talked on the phone briefly, but I've got an email from a high school on the east side, and out of respect for that group, I won't give you the name, but there's an east side high school that's offering or telling folks that we're going to have breakfast on the morning. Over 140 people are invited in a media center environment. How is that appropriate? There's no way you can follow CDC guidelines. I understand that traditionally we have breakfast and we get back together and we socialize and spend time with each other. But right now we can't do these things. And the intention is good. I recognize that, and I'm grateful for the kindness, but we have to play by different rules this time around. And so, that's just one example of where things are happening without our input to provide a different perspective, to keep everybody. That is the bottom line here. We're just trying to keep everybody.
That taking temperatures as they walk in the door, even though it's no longer required by CDC, from what I'm understanding, is one of those measures that we're putting into place to keep everybody safe. And more than instead of administration, we're saying along with administration, we need support. It's going to take more than one or two individuals to do that every day.
So respective to keeping everybody safe, if you're talking about office specialists who are in the front office area, who receive every visitor on campus, every faculty member goes up and checks the mailbox or does what they have to do in the morning signing in, every vendor, every delivery, these people are super exposed already. And so we're taking the lowest paid folks on the campus and we're saying to them, we understand where you are proximity wise, but ask you to pitch in, and you're going to zap every kid or adult that comes on campus, and you're going to be exposed to them as well. I don't feel that that's equitable. Going back to what I was trying to mention earlier, I noticed that in this document that articulated how some of the CARES Act money was spent, in the salary and benefit line, it says clinic attendance. Is that to pay for additional folks that might be able to do this work, or is that something different?
I have Deb here. She can address that.
It's clinic assistants. It's nurses and clinic assistants is the proper terminology.
Well, I'm just reading it. It says attendance, so thank you for clarifying that. You said assistant. So what's the difference between a clinic assistant and the school nurse?
I think it's their qualifications as far as some schools, if they have students who have certain medical conditions, would require a someone in the clinic who has more certification than a school who does
RN.
not have require an actual RN. Some schools require an LP. I don't know all the initials. Some require an LPN, but it depends on what medical conditions you have on your
Okay.
campus, and they're assigned according to
Okay,
that.
because the line item says nurses, clinic attendants. So I'm going to include clinic assistants as well. Do you have an idea of how many of these folks we're bringing on? Because I'm thinking these are new positions, not current positions.
They are current positions.
So these are already allocated positions and we're running the funding now through the CARES Act?
You want to?
Yes, based on the projected loss of revenue, yes, we are.
Okay.
The projected loss of revenue after the October count?
Right, because our funding is going to be preserved through the fall.
Okay, so let's go back to that again.
Wait a
This is
second.
not-
So hang on. I'm sorry, Deb, to interrupt. I don't want to have the funding conversation right now, and I know you don't want to do it again. We've already done it a couple times. I'm not trying to be I'm not trying to. I do want to stay on this first, though, if that's okay. I just want to stay on the OS.
It was put there, so I feel like we should explain
Okay.
that I mean, a statement was thrown out there, and so we'd like to offer that explanation to people listening.
Are there?
So-
Oh, it's
So
coming.
DOE is saying that we are going to be held harmless for the October count, but they also have said that all of your live ones, but the virtual students will still be required to complete their courses to be funded, as well as they haven't said that the Family Empowerment Scholarship will not be adjusted since they've created more than that number of scholarships, more than doubled that number of scholarships for this year. So yes, conditionally, we have asked DOE to approve that funding be shifted from general fund to the CARES Act to hold us. So I don't even think that it's going to hold us harmless, but to help. At this point, as I explained before, Elizabeth, I'm not trying to be difficult, but our funding is completely and totally unknown, and I have to protect the district. That's my position.
I know, and I thank you again for that explanation, Deb, but you know, we're looking at it from two different angles. I respect you looking at it as the CFO and doing what you're supposed to be doing, and I'm hoping that you're respecting me when I ask these questions and continue to just state that, you know, everything in the future is unknown, just like you said. And so to err on the side that the sky is falling, I think isn't really appropriate. I don't believe that there's been any hard evidence that states that we are actually headed for a fall. Everything is speculation. But we have unassigned fund balance, and I know a raw subject. We talk about it every time we talk money, and we have the same conversation over and over again. And so you know, this family empowerment scholarship, all these things that you're mentioning, it's speculation right now, because according to the DOE emergency order is that funding is going to be preserved. The VOL situation has always been that way. We don't get the money until the kids complete the course. We understand that's the way change. The change is that we have a bunch of kids shifting over there right now. I get that.
Excuse me, but 12,000 is a little different than less than 100, okay? It's 2,000 per FTE loss in revenue for online learning students, and it's not speculative, okay? Could you please talk to your other reps across the state and see if I have a call every Wednesday with DOE, and DOE has no answers yet. Everything is, we're not sure, we haven't heard, we'll get back to you, we haven't advised yet, okay? So don't say it's speculation. It's not speculation. It is being fiscally prudent, and that's my job.
And again, I respect you for doing your job so well. I'm not trying to be difficult with you either. And I do have calls with the other local presidents, and what we're hearing is a very similar thing. and some districts, and I'm so grateful that you're not doing this, but in some districts, they're taking the CARES money and finding a way to stick it into the fund balance. So I'm grateful that we're not there. But, I think that we have to be reasonable when we have conversations. And when I look at the way it was allocated, it just doesn't make a lot of sense to me. We're using the CARES Act money to pay for, using the CARES money to pay for Canvas, Eduphoria, iReady, paying for summer recovery transportation. And I know we had a little bit of you clarified that the GEARS money couldn't be used for transportation. That's something I learned in listening to your comments last week. So thank you for that. But Deb, I think it's more about having conversations about equity and about being able, instead of investing in programs and software with this money, this CARES Act money, non-reoccurring money, should be used to support our folks during this hopeful non-reoccurring time in history. It shouldn't, from my lens, it should not be used to pay for things that we've already got. That's what I'm having such a hard time understanding.
Many of those programs that you just listed are not things that we paid for out of the general fund.
Canvas.
They're new and specific to this plan.
We're not paying for Canvas out of the CARES Act. We are paying to have all of our testing that's in Eduphoria converted so that we can use it in a new program. And iReady is very expensive, and it's not something that we would have done had we not had learning loss. A lot of these expenditures are to support the loss of learning for students, which is what they directed us to use the CARES Act for, as well as the computers, which the board has directed us to. We cannot afford that otherwise in 1 year. Okay, we just cannot. It would cost us $20 million to replace all of our computers so that we had to go to 1-to-1. We're trying to minimize all of the funding that we have. We've included training for teachers. There are a lot of items in there that have nothing to do with protecting our general fund, Elizabeth. And continue to debate that because our application has already been submitted to you.
Right. What I know, and again, Deb, not trying to argue with you, because what we know is that according to the discussion that occurred at the board meeting, that this can be revisited and the board could make a change in their decision. We know that, but also that when we invest in things like, and I appreciate that, and I'm glad that we're thinking about the students, but if we don't have employees in the schools in order to provide the tutoring and to utilize what they've been trained on because they're out sick, they decide to leave Volusia County because they can't continue to stay home without pay, what good is it going to do to us? So, for us and for the kids. So
well,
I think that,
what about the PPE? I mean, I haven't even included that. I haven't even included the
right, but we know that there are other funding sources that can be used for that. FEMA. I know you don't get reimbursed 100% for FEMA, but and this conversation was intended to talk about the office specialist, but the whole thing with the money, I think we do need to revisit it because we are seeking some assistance for our folks, and if we can't afford, they have to go out. And we had this conversation yesterday, so I don't want to resurrect it necessarily. I just think that all of this is for naught. So do you want to go back to the temperature conversation?
Yes, Elizabeth, you had since you specifically mentioned me, let me jump into the conversation here. We did have a number of meetings. Lots of meetings. You were invited to as many as we possibly could invite you, particularly on those areas, Elizabeth, that was anything that was even close to outside the contract. A plan has been written to follow our contract very specifically, our collective bargaining agreement.
I'm
sorry, can I finish?
Well, I can't hear you is what I'm saying. I'm having a hard time hearing.
Closer to the microphone.
That's a lot better.
Sorry, we had to move
Okay.
to me. Sorry
so now
about
I can hear you.
Thank you. Yes, we did have a lot lot of conversation. We were very careful to make sure that we told our folks to create a plan that was going to be within the collective bargaining agreement, to follow the job descriptions that we currently have. So nothing that we are asking an office specialist to do is outside of their job description, okay? In fact, it is part of what their routine is, according to what I've been told in regards to office specialists assisting in the clinic. It is not anything that we want to put them at risk for any more so than anyone else on our campus. And in other words, we do specifically feel that with the CDC guidelines, following the PPE, following our social distancing, following the guidelines that we put in place, we're trying very carefully to make sure we're not putting people at risk. That is part of the temperature, part of what they do. So the whole idea of anything that out terms and conditions, we're making sure that it's within the terms and conditions of the collective bargaining agreement, and also that it's within the job descriptions that have been written for those office specialists. So we've written a plan, and we trust assistance and with your help as much as possible to do what's reasonable for our students and to keep our employees as safe as possible. So that's why everyone is.
Well, I'm just going to point out to you, there's nothing in the job description that states that they need to take temperatures. And because of that, that's all. And I would push back a little bit on your statement about being invited to attend multiple meetings, to have input, and so in crafting the plan. I will reiterate the fact that we were invited to sit in meetings where the plan was shared with us. Absolutely. Never would state that we weren't an active listener, nation of the plan. But I'll tell you, Mr. West, and I would expect you to check these facts, that as a participant in the presentation in the draft formats, I specifically asked to receive the plan prior to the meetings that we were invited to, so that our team could review it and be able to provide informed feedback. Never once did I receive it in enough time to turn it around and be able to afford appropriate feedback. As a matter of fact, and please check this, I actually had to reach out to Pat Ann prior to the time that it was presented to the board. And the conversation previously was, could we please have the plan when you finish it so that we can review it? The expected timeline was 12 o'clock. The board meeting started at 3:30 and I had to send to receive it. So when we talk about a collaborative back and forth process, I can tell you that it was not so. And I'm not pointing a finger to anyone. I'm just giving you the facts. So we're all entitled to our own opinion, but we can't make up our own facts. And that is the fact of that situation.
And
so thank you for listening.
Yes, ma'am. And I'm not trying to make up any facts at all. I'm just simply trying to say that, to have that conversation, I want everybody to understand, and we to actually involve as many people as possible in on the plan. I know it was chaotic in putting the plan together because we had so much to consider was possible. And we also wanted to make sure that we stayed within that descriptions and stayed within the collective bargaining agreement, because that was very important to us. So our feeling is that this part of it is part of their job description. But Elizabeth, let me do this, okay? Because recognition that the taking the temperatures of our students is it's going to be a monumental task. So that's something that we will go back and take a look at and review. And it specifically because what we've tried to do is follow our CDC guidelines along those lines. But specifically, if the CDC guidelines is saying that we don't do this, then I'm not sure exactly what it is that we need to do in regards to requiring that. So let us review that aspect of it.
Sure.
Okay, is that fair to do?
Yeah, sure. That's fair to do. Just a couple things in closing. You're absolutely correct. I do believe you involved, or not you, Mr. But I do believe the district involved many people in the development of the reopening plan. It's just that it didn't involve all of the stakeholders, I believe, that needed to provide input as it was being crafted. So I think you're right. There were a lot of people involved, but maybe not everyone that needed to be involved. And so I'll just share this. I received some information from one of our members yesterday who was sharing that her son and significant other, husband, I don't know, they both have COVID, and neither. So that's a real serious issue. I'm not saying that temperature checks are not a good practice, but I don't believe that they always catch everyone. And so you could have someone who's asymptomatic, never registers a temperature. How are we going to know?
Right.
So that's something to
And as
consider.
the guidelines change, we're changing too. So if you, do you want to caucus or
No,
keep going?
I think.
Keep
we're
going.
fine.
Okay.
Are you okay with going on?
Mhm.
Okay.
So that is something we'll consider and get back with you on.
All right. So are we going to do retirement incentive?
Hold on 1 second. Deb just left the room.
Who did?
Deb,
Deb, I'm
the
sorry.
one person I need for the retirement
Oh, Deb.
incentive.
Okay.
Yeah.
It's hard.
Yeah.
Sometimes it's hard to hear you guys with the masks on.
Yeah, sorry about that.
No, that's,
Yeah.
hey, guidelines.
It's our new life.
Did she go?
Let me find out.
She took a call. Let me see if I can find it.
Okay.
But
We're getting her, sorry.
No, it's okay.
I don't know if she's on the phone with that one, tap her on the shoulder. Heart attack.
Yeah. Okay.
go ahead.
Oh, Elizabeth, she's just a minute. Can we, is there another topic we can go to and come back to that? Or, I mean,
Okay.
wait,
Dr.
it's gonna be just a minute. But
Is Dr. Ramundo there?
yes,
Could we talk about pre-K and VPK blended?
yes, good idea.
Okay.
All right. Oh, you've got your screen up, so you can talk. Okay.
Okay.
Yeah.
Good morning, Elizabeth. I'm well, and you?
I'm fired up and ready to go.
Okay. From the information that I did receive based on some of the questions we had the other day, as long as the allocations are given to the schools for the VPK units, those are not being called in any which manner. And the other thing is that based on the Early Learning Coalition and the state statute, there are 3 options that are provided for VPK in order to use their vouchers. One of them being the option that they have, they must attend a 540-hour in a public school. And so that is the option that we have, but nowhere in there are any of those 3 options inclusive of online language, online learning language.
And that was VPK?
Yes, ma'am.
So what I think you're saying is VPK cannot do online.
Correct.
Okay, but pre-K,
I'm sorry to interrupt. So I just want to make sure you said there's no language in there that
Specifically
They're like-
states online learning. It has 3 options. There's a summer program, there's a blended program, and then calls for one that is in a regular 140-hour in-school program. And that's as per the 3 options that are provided. It did not say specific language of an
but it
online
didn't prohibit
program.
it though.
It didn't specifically state, no ma'am.
and what is when you said blended, is that the blending that we have with pre-K?
Yes, ma'am.
General
ESE
and
and
the employee
the
program.
employee program.
Okay.
And as far as I was aware and had conversation with the coordinator herself, there was no talks at any time of ever taking away those units.
Okay. But pre-K can do the online program.
The,
Pre-K, not VPK.
Our ESE pre-K program. That's
is
what you're
that the one
talking
you're
about?
talking about?
I guess.
Yes.
Well, don't we have both, right? We have, or
We
is it
don't.
pre-K, VPK?
Okay, we have VPK, which is funded by the
Right.
vouchers, and that is for general ed, any age 3 to 4 student. And then we have our ESE pre-K model, which it only serves
Right.
our students with
Okay,
disabilities.
so there is no gen ed pre-K because that's VPK then.
That's correct.
Okay, all right. So let me just, and if you don't mind, in a moment, I'm gonna ask one of my team to participate because she is the expert in this area, but I wanna just make sure where we're going here. So as it relates to providing educational services in our elementary schools, what are we suggesting with this group?
We were suggesting that they have their, they would attend in school because of the ruling that they have to be signed in and out. We have to account for the 540-hour program. So they were strictly returning to the school.
Okay, and then when we did when we did the school closures back in March, April, and May, what
They
happened with,
received packets is what they had. There was no online option for them as well.
okay. All right, and then the teachers and support professionals, they just made contact with the parents, obviously, through
Yes, ma'am.
Teams or telephone calls or emails.
Yes, ma'am.
Okay. And so for these students and their parents, what are their options for returning to school? Just brick and mortar or Volusia Live, or only brick and mortar?
It is brick and mortar.
So if a parent says, I'm not putting my child in brick, they're just going to remove the child from VCS completely?
I'm assuming that would be the option that they would have at that time. Yes.
And don't we receive funding for the pre-K? I know the Early Learning Coalition voucher pays for VPK.
Yes.
Right? But we get the ESE funding money for our ESE pre-K, correct?
Yes, ma'am.
So wouldn't we want to provide flexibility for that group in order to not just for funding purposes, but to maintain educational services? Because where would they go, Dr. Raimondo? I mean, I don't think they go to FLVS, do they? Where would they go? Private?
It's not.
No.
Where would they go?
Well, brick and mortar is their only option at this time.
Equitable?
I
So let's
can't
just,
say one way or the other, but that is the way that the Early Coalition has put out that language specifically. They have 3 options, and those are the only options. It would be the summer program, it would be that specialized program, or the 540-hour in a school district. And so therefore it calls, like, it doesn't specifically say online is not an option there, but these are the 3 that have been provided as per Early Coalition and the statute language.
And remember, I know you said you had someone who's a pre-K teacher, so they'd be more an expert on this than me, but pre-K is not the mandatory school age,
No.
so that different guidelines than
Correct.
what our other regular school, mandatory school attendance age children would have.
And it does say in there is specific language within the statute. I didn't pull it out specifically. I can't tell you the article by heart, but it does say that parents do have the option to bypass that year, that 3 or 4-year-old year.
right, for gen ed, but our ESE, that's covered under ID. Those services from 3 to 5. I mean, and really to start providing services and start assisting, I just feel like if we don't offer them some additional options, we're going to end up losing those folks. And, potentially, you want to talk about learning loss. Wow. So I'm going to ask Valerie if that's okay? Valerie, do you want to jump in and maybe ask some questions?
Sure,
Help
yes.
start the conversation. Everyone, this is Valerie Jessup. So,
Hi,
So when we're talking about the VPK, would it be an option at this point to put them back on packets to give them other options so that they would still be with the VCS?
you're muted, Dr. Ramundo.
I'm sorry. At this time, honestly, that is not an option. We want to provide the most beneficial education brick and mortar, and having that instruction from the teacher would be best.
Right, but with the kids that are have underlying health conditions or have family members that they're staying with, would that not be beneficial? Are getting that early intervention and the VPK? I think it would just be beneficial to have all of them have those packets so that they have that option, like all the other kids have that option.
I understand your position, and we can look into that, but right now it is a brick and mortar.
Is there anything, can I jump in and ask
Sure,
a question?
go
Sorry, because I think out loud sometimes. Is there anything that would prevent us, like if a child, because right now, I understand what you're saying. We're saying either they come to brick and mortar or they stay home, because those are the two models that we offer. There's nothing to prevent us from sending materials and things to support at-home learning. The issue is going to be whether or not we were within brick and mortar.
Right,
Correct?
and the way that it reads is that they have to, attendance portion of it as well, attendance policies. We must maintain the 540 hours. There's an accountability piece that's attached to that, and I consent specifically have that language within it. So therefore, for the voucher, the 540 hours, if they decide to remove themselves from that program for whatever reason and decide to go elsewhere, they cannot have exceeded 70 hours within the brick and mortar.
So I have a question though. So we have attendance criteria in pre-K 12. We have attendance criteria there. And so we are, I guess, going to work out a mechanism like attendance for all 63,000 students that we have. And some of those students are choosing that stay-at-home option through Volusia Live. Now, whether it's appropriate for a 3-year-old to be on a digital platform, you know, I'm thinking probably we're all going to agree that not. But if we have those attendance abilities to track the other students who are choosing to learn from home, and paper packets might be the most appropriate way to with this.
We're not offering paper packets to anybody else.
Well, this is where I'm going, thinking outside of the box. I mean, why couldn't we track that attendance, you know, in a similar way?
No, because of the brick and mortar, that was an ICP for this particular. They have to be with attendances tracked that way.
And Elizabeth, I know you heard as well as we did that ICP was not supporting our learners at the rate that we would want to, or it wasn't serving our learners or our teachers. I know you heard that. I heard it too, loud and clear. And so
I think the point that I'm trying to make is that for this group of students, I think needs to be a certain level of creativity. They're, as Valerie pointed out, provide those early intervention services. But I think that they deserve more than one option, which is brick and mortar, because if we don't provide our option, potentially we're going to lose them, and the kids will continue to, they won't get their services that they need. I'm wondering how some of our other districts, because we know that there are other districts that are beginning virtually. So there's got to be a way to do this. We're not the only folks with VPK and pre-K ESE kids. So have we looked to see what the other districts are offering? I mean, I could do that. I could reach out.
As far as some of the ones that we have looked into, specifically one that we can mention is Miami-Dade, their VPK students back, brick and mortar.
The class sizes for that, I know specifically at the school I'm at, they have 8 ESE kids to 10 VPK kids. Now, with ratios changing due to CDC guidelines and classroom sizes, how are we going to reduce the sizes in those classrooms?
There is a specific ratio and to teacher and student, and therefore we would have to look at that. Right now, we don't know the complete enrollment of all of the students, but we will look into that, and I'll probably have some more information for you on that one.
Okay, thank you so much.
Thank you, Valerie.
All right, well. There's only brick and mortar, that's, I don't know.
I have some questions about just regular pre-K, not pre-K ESE, not blend. Is that going to Volusia Live? You know, we need to have options. So my question is, if a teacher decides that they need to do Volusia online due to underlying, how just choose that option, how are they going to replace the teacher in the classroom?
Specific teachers for VPK have to have several certifications and things such as that.
Not VPK, just ESE pre-K.
Okay, so the situation is that we would need to make sure we look at those teachers and find the right credentialed teacher to be able to deliver that instruction.
Correct. Now, another question. I'm sorry, I have so many questions.
No, that's okay.
If there were to be a para, because I know we were talking about support staff having other options than just going back brick and mortar, would there be a chance to have a paraprofessional go and do the Volusia online part and be that? Because when our teacher is out, we step up and become the substitute and follow the lesson plans given. And so I don't see how it would be different if we step to Volusia Live and follow the lesson plans that were given to us by the pre-K.
So Valerie, at this time, we don't have a procedure for that. It would be the teacher delivering the instruction, and the only one is a brick and mortar. Since online is not an option at this time, that has not been a conversation that has been entered into a full response on a what if situation.
Okay. Then could you answer what positions are available to paraprofessionals who have these unsafe to go back to work? Because at this point, we just have brick and mortar. We don't have choices to go to Volusia Online or Volusia Live, to my knowledge.
No, that's correct. You're correct. We have the brick and mortar option for paras, and that's it. But the only thing we do have is they're afforded the same opportunities as all of our other employees.
Well,
but you're correct.
Rachel, about making it equitable and letting support staff also have that option for Volusia Online. I know we didn't specifically agree on anything, but I know it was talked of on your side. You had said anything, because I know there are other ESE units that aren't pre-K, and you know they have a lot of questions too as to if the teacher goes to live, how are they going to fill that spot before school starts, because that's coming up very quickly.
Right, and those assignments are solely based on student need, not our assignments as far as paras go, and allocations are solely based on student need and how those IEPs are written and driven. So those are being analyzed all of the time. Even when we have regular school, when we're on any normal year, I know when I was principal at a school that had several different ESE programs, we would our para allocation was the one thing that was changing all year long and was very fluid,
Right.
the para allocation, because the student IEPs drive those staffings much more so than it's not about just a number of kids. So
Correct.
we're going to have to, you're right, we're going to have to keep looking at that.
And then what about one-on-one paras for the kids in the elementary level? If they're doing Volusia online, they are not going to need that para this year because the parents will be responsibility in helping their child on Volusia Live. Where are they going to allocate that para? Or are they just going to lose their job?
Well, no, that's not what we're talking about here. So the same thing that would happen, no longer require, because we have that. We'll assign one-on-one paras if the IEP calls for it. And then the same thing that would happen if that child moved out of our county, or if that child got to a point where the IEP no longer required that para, we would go through the same kind of displacement process or place the para where there is a need, because as well as I do, I've been in this a long time and I was an ESE teacher. So we know that one need might go away and another need pops right back up. And usually it's 2 or 3 needs pop right back up, right? So there would certainly be opportunity, may not be with that same child, but there would be.
So do you know when thank you, excellent job, Valerie. So do you know when those, that information might be readily available to our support professionals? I know we're still working with identifying which options folks are moving into. Do you know when we might be able to start sharing that information?
Well, right now, the information that they have is the current information. That's what we have is based on their IEPs and rewriting IEPs. So the assignment that they're given right now is the current assignment. Now, we all know, and I just want to say this, and I think we had this conversation district-wide even yesterday after bargaining, is when we're really going to know, Elizabeth, we have all this, we have survey data. It's being disaggregated now. It's being shared with the board. It's going to be shared with principals. It will be shared publicly. However, when we're really going to know is August 31st and beyond. And every day I expect, depending on numbers, we wish we had a crystal ball, but we don't. We're going to have to be fluid within them. Just like Dr. Balgobin said, we'll know August 31st when kids come to school. We have a number of best guesses and we a good position to make some decisions based on the data that we have, but it would be unrealistic for us to sit here and say we know for sure who's walking through those doors on the 31st.
Well, and again, that's and I understand what you're saying, and that's from the lens, of course, of the student. But again, for the employees, that just kind of puts them still in that limbo period where they're not able to have the ability to take a breath and know, okay, yep, I'm assigned here. I'm going to be doing this for, even a semester. So
I would love to give them that. I would love to give them that. But the reality is that what we can talk about is what our projected numbers are and what we feel like. But I also don't want to put somebody in a position where I'm going to say, I guarantee you, this is your spot. This is where you will be. Nothing will change. And then we have completely different numbers than what we projected show up. We have to make that change. Now, to an extent, every year with the 9-day count, this is process or procedure as far as adjusting staffings or adjusting assignments. Every year, to some extent, we do this with the 9-day count. This is on a much larger scale. I'll grant you that. This is a much larger scale.
Do we have paraprofessional vacancies currently?
Yes.
Yes, we do.
they significant?
I would
I can
not,
look it up.
we're gonna look it up.
Okay, I just think that some kind of affirmation that, yeah, we can't guarantee you that it's at, you know, Palm Terrace necessarily until we get the hard numbers of enrollment, but just the security of knowing they are employed for the coming year, I think
Yeah.
would be significant. And maybe if we could at least articulate that, because I know that one of the biggest concerns out there, and it's lingering based on comments that were made for some reason or another, is job insecurity. They're very afraid, and Valerie asked as well, they're very afraid about layoffs and furloughs and loss of their, and so if we could assure them at least that they will be employed, you will be earning a paycheck, that I think would be a step in the right direction.
Okay.
Could we?
And check to see how many vacancies we have right now. What we can assure everyone is that we will not understaff our schools, and we will need people to be in the schools. I can't give you a finite number, and I think, and I know that that's what you want, but I can't give you a specific number of, we're going to have this many paraprofessionals or we're going to have this many teachers, because we don't know what it's going to look like. But I can promise you, we will not understaff our schools, and we will make sure that we follow the process. And again, Elizabeth, I'm going to go back to the 9-day count. This is not a new thing for us. And I think about the conversation. I don't really want to go back there, but I think about the conversation that we had with the budget, and we know that, like, there's always, we know at the 9-day count, it usually works out. However, there are always people who don't want to move, that we have to say, we're sorry, but we lost a number of kids at this school because we didn't anticipate it. And that's what happens every single year. And this is just a much larger scale. And I agree. It's a much larger scale, and it's one that we're going to have to handle very carefully, but it is the same thing.
Right. Well, it is a little bit different though. And I think all I'm asking for is is some kind of reassurance that you're not going to lose your job. I mean, to put it very plainly. And I understand the 9-day count. We do have it every year. You're right. Absolutely accurate. But people don't lose their jobs. They may shift, but they're not all of a sudden applying for unemployment. And so that's the message that I want to get out, so that our folks can start to have a little bit of sense of control over their lives. Because I think that's part of the big, there are so many unknowns and uncertainties, and people don't feel that they have any semblance of control. And that's a very scary feeling. I've got folks telling me they're having panic attacks over all of this stuff. And I'm sure you're hearing the same thing. So I think, yeah, and we don't want our folks to
I
do that.
I hear it every day. And, you know, I don't think that is unique to education either. I think it's a nationwide problem in every industry, the world. Of course, we're only worried about education, but these are uncertain times for everybody. And that's why when we are looking at training, and when we're looking at the presentation that we did for the back to school program, we were so careful to include, and I don't want to lose sight of that SEL component, not just for our kids, but for our teachers as well, because this is a scary time for everybody, and I don't think that's unique to education.
Just one thing too, and I want to just confirm this in this forum, because I'm not sure that administrators have articulated this to their support professionals, but paraprofessionals are starting on August 13th, correct?
That is correct.
Okay, just want to make sure publicly we see that, in case communication has had a hiccup somewhere. They are starting on August 13th and will work going forward.
Right, that was their original start date, and that will continue to be their date. We do feel that the training will be very valuable to them as well.
Absolutely, okay.
and they
Thank
can assist with, we know that there's going to be some preparation of rooms, classrooms, and campuses that we're going to be, you have to be very thoughtful of how we make the physical environment for the kids to encourage social distancing and that kind of thing. So.
All righty. Is Deb back?
Deb is back.
Yay. All right. Welcome back, Deb.
I just stepped out for a phone call.
Yeah, no problem.
I'm gonna move the speaker down closer. Hold on one second.
Thank you.
Okay.
You know, I
Yeah.
just had a birthday. It's getting harder to hear. Yeah, exactly.
Okay.
No, I was waiting. We're going to talk retirement.
About retirement incentives, so.
Okay.
No, because we shared a proposal.
Yeah, so you shared a proposal. And I know that initially we had looked at the Flagler proposal. Proposal actually increased the request from 18% bonus to 25% bonus, as well as added the longevity bonus. So we took a look at that, and I guess let me start by just explaining the components of what your
Can I
request
interrupt for
is.
just a second? Is there
So-
any way we could see do you have something you could share your screen so we could look at, or can we see you, or?
Well, let me talk about the components first. So, because I'll share with you what the components are and the concerns about.
Are you logged on?
What
Are you logged on so you can share your screen? Okay, that's fine.
what the
I can turn my computer.
It's just hard to talk to a square.
Come sit down.
oh, you want me to log on? I can log
No, come
on.
sit down here. You can look at my.
Okay.
There you go. Hold on 1 second, Elizabeth. We're
Okay.
rearranging.
That's a lot
Is
better.
that better?
Thank you, Deb.
You're welcome. I thought you meant share my screen as in what I
Oh.
was going to present. I'm happy to talk to you face to face. So the components of the bonus are taking the employee salaries and taking 25% of that salary. So under 62, that would be the only option, right, is to be offered a 25% bonus. And we also would have the benefit cost included in that. Then for those employees 62 and over, if they're between, they would have the option of the 25% bonus plus the second option they could have instead would be one health insurance, depending on how many years they have till they get to Medicaid or Medicare, I'm sorry. And so we looked at that, and then you also added in the longevity bonus, which was 10 years experience, 10 years VCS experience, they would get $1,000, and 20 years they would get $1,500, and then $2,000 if they had at least 30 years or more. So some employees are already 65, so they would only be eligible for the salary bonus. The other thing that we needed to look at associated with that is what savings would we see from hiring new employees at a lower pay scale possibly. And so one of the challenges right now is actually looking at what that average pay scale might be, because we're looking at the teacher salary allocation, and we have to still calculate that, which, you know, would increase the beginning salary up to $47,500 depending on the allocation.
Can I ask a question real quick?
Sure.
So are you saying that you are going to make these determiners based on the governor's teacher salary law?
No, what I'm saying is that if a teacher right now is making $70,000 and they retire, then we would anticipate, normally we use for an average new teacher salary with a tier F,
Okay.
right? But knowing that this year, that we will be applying the teacher salary allocation, so the average salary may increase, and we don't know exactly what that's going to be yet. That would be, that would be a decrease possibly in the savings from hiring that new teacher.
Okay.
The other, and let me just say that we do budget. If we know that teachers are eligible to retire, especially the ones in drop, okay, we do budget for that savings. And I don't know if you recall, when we present the budget and we present, our increased costs, our decrease in costs that are anticipated, and review that with the board, we will show teacher retirement savings. So we budget for that savings. We anticipate that there will be some every year. So what that does for us is that savings would be moved up currently. But the opposite piece to that is that we also have to pay out terminal leave. So that's an additional cost that the district would incur, is paying out that terminal leave early. So that's part of what we're still needing to analyze, because, we could say, okay, this is what it will cost us. And then we could say we have this much savings, but then if teachers are retiring that have a large terminal leave balance, that could be a significant increased cost. So that's what we're working with. I will tell you that looking initially at the 25%, that would cost the,
That the
without
25
even looking,
I'm sorry,
without even
Ms.
looking
Miller?
at terminal leave. Yes,
That's the 25% as a whole, or just the under 62%? Is that the whole thing?
Yeah, looking at 25% for under 62. And then if you calculate the cost of the insurance for each teacher, plus you calculate the bonus, and you take the larger of the two, assuming that that's what the teacher would take, they would select that, then it would cost the district money, even with some
Okay,
savings.
so did you run those numbers yet, or I know it was short notice?
Yeah, and now I'm not sitting at my computer though. So.
All right, would you be able to send those over to us today?
Yes, but what I want to tell you is that we haven't analyzed as well what the terminal leave is, because that has to go based on teacher by teacher.
Yeah.
To analyze what their terminal leave, what their balance is, and then the cost of it. So I don't know that we can get specific on that number. We're probably going to have to use some type of average,
We don't know
because
who will choose
when we pay
it.
out the terminal leave, we pay it out at their current
Right, and so that's
salary.
why, and if you think about it from a different vantage point, if we pay it out early, we still, in the long run, would incur a bit of savings, maybe not a whole lot, based on, just salary increases that will be afforded as people stay. And then using your own numbers with that $70,000 figure for a veteran teacher salary, if we looked at the attrition and the cost saving, even at the 47.5, the difference there is over 22,000. So if we have someone who's making, so what I'm saying is, if someone is earning $70,000 and they opt to take this retirement incentive, and then we bring somebody back in, even at that higher rate at 47.5, we're still saving in the long run, because there's that.
I understand that, but when you net that out against the bonuses and the longevity, there's still a cost to the district of about 800,000+ without even factoring in any terminal leave payments.
Well, and as you know, as the years go by, we're going to keep saving, right? Because they would go out now, and then those, what I'm saying is we are not going to continue to pay those elevated salaries, or those salaries that are at the higher end of the scale necessarily. The
Salary
gap is
ask.
going to
I
get,
understand that, but we already budget for that savings. So but then we're also facing the terminal leave payouts sooner. And so we're not opposed to the bonus at all, but it can't be a cost to the district. I mean, it has to be, at best cost neutral to do this, because again, going back to what we're facing from a financial perspective this year, that, we can't pay out more than we're going to save. And we already budget for some of that savings. So for instance, those teachers that are 3 years away, we would already anticipate a savings in 3 years from now when they retire. So we would have maybe 3 years of additional savings, but we're also now going to have to pay out the terminal leave in advance.
right, but
So we really have to match we'll say, I mean, not I'm just using 70,000. I'm not, they're all, I mean, the teachers that are under 62 and have 30 years of experience probably have, the higher salaries, but those with the health, and not all of them, but I'm just saying that some of them do. So there's really two distinct groups that we're talking about.
So what do you,
and I was curious why you picked 25 versus the 18, as well as added the longevity bonus.
well, Deb, it's like anything, right? Come on, Deb,
Aim high.
Yes. Well, we're trying to help our folks too, because this is a big deal. Like if I had planned to have X number of years and now all of a sudden catastrophe strikes, and I'm really thinking about what, I want to set myself up so that I can really sustain that gap that I had anticipated being able to work, but now because of personal decisions that I need to make for myself and be destitute, I want to have some ability to.
Well, again, and recognizing that this is a personal decision for many people, and we have to look at it from the financial perspective, not necessarily, I mean, obviously we care about our teachers, but everybody has their own personal circumstances. And so we have to make sure that we're being fiscally responsible for whatever we offer.
I have a question. On the terminal leave, I'm sure you have a figure that you use every year because there is going to be terminal leave every year. Is there like a certain number that you use for payout?
Hold on just a second. I was trying to find out. No, my phone. Sorry, my other phone over there. Did I bring it? Oh, sorry, I have it.
Sorry, whatever.
We have too many phones on the table. I was trying to find out. Let me see. Wanted to confirm what it was. I don't know if I've gotten it yet. Okay. So let's see. Our budget. So our budget for drop for this year or for last year was 2.1 million. The actual expenditure was 2.8 million. So we were 700,000 over budget. And our budget for terminal leave was 2.8 million, and we spent 2.7 million. So we saved 119,000 there. So that, I mean, those are just,
And that was for 1920?
That's just
those are the actuals
yes.
and the budgeted. Okay.
Correct.
All right. So do you guys have a counter, or are you still working on it?
Yes. So we're on it, but we definitely, will come up with a counter.
Okay. All right.
We knew that it was going to be somewhat a cost, but we knew also too that cost could be you could save on that later as the years progressed. So we knew it wasn't going to be budgetary, but we didn't. And I still don't think where you are right now with the 800K is, shocking. But we knew it was going to be a cost.
Well, I mean, we recognizing that we have $1 million fall in our general fund budget that we're proposing, I don't think that the board would, would be fiscally prudent if they say, okay, I didn't add another $1 million to the budget. So, that's clearly a concern, that cost.
Okay. So I don't have that proposed budget not today as well with these numbers.
The proposed budget is on board docs. I don't know, Elizabeth, can you provide?
I got it.
Can you provide? Okay.
Yeah, we can go in there and find it. I just thought maybe you just had it, push a button, send it, but we'll go.
I can, but I can't. I mean, I have to pull it up as well, so I can send it to you.
Okay. All right. Well, so there'll be much more conversation about the retirement incentive. Do you think we'll be able to have that this week? We have another session on Thursday, or do we need to look towards the following week?
We'll do our best to have, at 98% done at that point on Thursday to share with you.
Okay.
Hopefully we can share it in advance. Because we also have to look at it from the big picture with, you had asked about, you had suggested that was for all employees, including, your support staff. So we've got to pull it up, and it's easier for teachers for us to do that analysis just because, they all have the same starting salary, but we have so many different positions in support staff that it's taking longer to pull up that analysis.
Okay, but that is important to us. We want to make sure we offer it to all members of the bargaining units. Okay.
Well, and we need to look at non-bargaining as well.
Well, okay. All
Thank
right.
you.
You're welcome. Okay, so next on the agenda was talking about Volusia Live again.
Okay.
So do you have some talking points?
Where did you want to start?
Well, I thought that you had mentioned yesterday you wanted to talk about the selection process for the Volusia Live teacher at elementary, but I really want us to, I'm wondering if maybe we could take a step back and go back to secondary. If we could talk about secondary first and then see where we end up there, and then determine if we talk about selection process at both levels.
Okay, that's fine.
Okay, so again, remains that doing two jobs simultaneously is counterproductive and not equitable for the teachers and for the students as well. So we want to make sure that we provide environments in which student is the sole focus in using one method face-to-face or through Zoom or Teams. And so that is where I would like to start the conversation, please.
All right. And so just so that I have a clear picture of, because I know there's been no proposal about this. So I want to make sure that I understand that that's your position across the board in every circumstance.
So for the purposes of teaching and learning, that is our position. Yes.
Okay. All right. And so I think we've talked through, and I have some secondary principals here who can elaborate on it if it's necessary, but I think we've talked through many instances where that is not feasible and not something that is going to be easily or even possible to accomplish. So I think that we are at where our position is that, just to be clear, so that we know going into this conversation where we are, we would not prevent it at the secondary level, but we're not going to require it. We would certainly want to, if possible, provide that opportunity, but we require it of every single teacher in classroom setting.
So I'm not following what you're saying. So are you saying that you're not going to make it a requirement, but you're not going to oppose it if a school comes up with that idea?
That's correct. If a school within their staffing and within their schedule can make that work, we certainly wouldn't say, no, you can't do that. However, we do believe that there are instances where it would not be possible, and we're not going to require that in those cases where it wouldn't be possible.
Okay, so let me ask a question here. Our middle schools are all going to have 7-period days, right? 7 periods a day, 48-minute class periods, correct?
Right.
Okay, so there's a consistency across the board. Are the high schools following a similar structure, or is each high school making their own schedule?
You mean as far as length of class period?
11 periods, I know, but is there going to be consistency at the high school level like there is at the middle school?
Yes.
So as far as the structure of the day, there's consistency at all levels.
Yes, but however, there's not consistency offered at each level with the numbers of staff and numbers of students at each level.
And I understand. I'm just trying to make sure that what I know is what I know. I know that the template, the building blocks, Galaxy is the same as River Springs, as Campbell. So as far as the structure of their day, the same. I'm just trying to find similarities as I think through this. So I have reached out to our members, and our members actually have worked in teams to provide a variety of scenarios that they feel would work. And we had a middle school group and we had a high school group, and they have explored a variety, had them exploring block scheduling. We had them exploring individual class period scenarios. We had them talk about being singletons and how, like, one teacher does all economics at a certain school. So every student that takes economics, and I think aren't all students required to have economics as a part of a graduation requirement? So this one teacher at this school teaches every child, and that's amazing. And when we've spoken with those folks, they're telling us that there is a way to get this done using dedicated class periods for Volusia Live students. We've also talked about, and a suggestion was made, to look at the Volusia Live students in secondary almost like an academy or a cohort unto themselves. And the logic there was that schedules are built for academy students as a group, and they funnel them through all of the necessary requirements. And if they looked at VL students and funneled them through those requirements with those dedicated class periods, that it could be accomplished. So without the specifics, those are just some of the ideas that we've been hearing from practitioners. And so I wanted to share those with you and see if any of that resonated with you.
I would love for you to share them with us, and let's talk through them because, well, I'd love to see them and let's talk through them. When they're creating these, it seems that this would work on my campus, but it might not have different lunches and different things. And honestly, I'd love to see what they are, what schools they're coming from, and then those could be shared with those principals. Let's see what you have.
All right, well, I have documents that they sent to me that, but what I'd rather do a conversation with you. So, or your team or, so I'm wondering, and I hate to use the committee word. I don't want to go there necessarily, but how would we facilitate that?
Okay, let me ask this. When you had them get together with their teams, was it like an individual school and they're doing it based on their school, or are they doing it based on multiple schools? Because what we would prefer is that they take these plans and we do it site by site. Like I have Dr. Derek here, so his team would go to him, they work out a plan that works for their site. That's what we would prefer, because a committee is not going to be able to make a one size fits all.
But I think a committee, but I think just as because each elementary school would have their own needs too, right? As much as middle school and high school would have their own needs, but we've already made some decisions that will be the standard methodology going forward.
And I'll be honest with you, Elizabeth, we have made some decisions going forward, but have concerns about those as well, because what happens when I have 3 4th grade teachers, but I only have 4 Volusia Live students? We're going to have to work that out internally, but you're absolutely right. We have made decisions across the board for elementary, which is a little bit easier because scheduling is very different at elementary than it is at secondary. And we do feel like that even when those unique happen, that we can work to overcome those and stay within the agreement and stay within the contract language. However, at secondary, it's a very different game because we have students taking 7 different classes a day with 7 different teachers, and teachers having so many more. But we are going to have challenges at elementary with doing a one size fits all. Just the challenges at secondary are so much greater.
Well, when the groups met, they were not school specific. They were thinking in general terms. They were thinking about bell chain offerings, and they paid special attention to that so that they wouldn't be limiting or creating a situation that could not be replicated. So those were some of the considerations that they did work under. So instead of me just shipping over, the documents that I have, I want to make sure that when we do send you these proposals, that we've had some conversation about the intention. So the only thing that's giving me pause about saying, okay, school sites, all 70 of you, go in, roll up your sleeves and do this work, is that, first of all, how will we vet them? We're looking at the turnaround time. What deadline are we going to, and we would receive them back and have to go through them all. I don't know that that's reasonable to do because school is going to be here before.
Why would we need to? Okay, we
would have to look at them for sure.
No, I'm not saying that. I'm just saying that if we have a school where the administration and the teachers agree on a plan and it covers the necessary items as far as a broader checklist, and I can't think of what would be on that checklist right now, but that we stay within class size, that those kinds of things, basic requirements. And there is no agree that the administration agrees. That's a very different vetting than a school who has come together and has not come to a consensus. And I would think district-wide, we would have a whole lot more who are agreeing than those who are not.
Well,
That would be where you would want to spend your time.
yeah, and in a perfect world, if everything was equal, and I said that, and don't take any offense to this, but we know there is someone in authority working with people who are not in authority. And I can tell you that sometimes people agree just because evils, and sometimes people agree when they don't really want to agree because they're fearful of retribution and retaliation if they don't agree. You know, we see that every single day in the office. We get, and
that
you know
would be
that.
why it would be so important to have your stewards involved in that conversation, because that is their role at the school, is to stand up for those.
Right, but our role with the district is to have these conversations at this level so that we can have the understanding between us. This is not something that we're going to roll down to somebody who is trying to manage how am I going to teach, how am I going to work with the kids, how am I going to keep myself safe, and oh, by the way, now I've got to figure out the plan for the school site. That's what we do here at this level. You know, if we want to have them work together to resolve minor things, absolutely, and I empower them to do it, is very powerful. But this kind of conversation and the talking about needs to be done here.
But not when it will apply to every school, and we can't.
There should be some very clearly identifiable standard measures that we say XYZ has to happen, and then, you know, then we can just look and see what they develop on their own, much like we've done for elementary.
Okay, are you going to be sharing those?
Well, not this moment. I mean, I'll send them to you later. I want to clean them up a little bit. I mean,
I don't expect you to share your screen right now. I just want to make sure that we're going to have access to those so that we can look and see, and then that will help us with our discussion.
So can I ask a couple of things about the high school model? And that is, some of the folks are sending emails because they actually already had faculty meetings, which I don't understand, but they've sent us emails that say things like they're going to be changing classes all day. The student will, I mean, are those not like basic parameters? We're not going to be moving kids all around a high school. I mean, do you guys agree that they're going to be changing classes, or are we putting in any parameters that say these things can't happen, now work around them?
We have not prohibited changing classes. And I think when I picture what you're saying, and I just want to make sure I understand, are you saying then that children should stay in one classroom and teachers rotate in, but if my schedule is different from my classmates, then that's very limiting to the courses that kids can take. So you would have to say eight kids are in the class have the exact same schedule because I'm rotating the teachers in. Is that?
Well, what I'm asking is from a safety point. So I'm going to have 7 sets of children coming in and sitting at a desk every hour. Who's cleaning these desks in between kids? Who's cleaning the chairs and the doorknobs, everything in between every set of those 7 sets of kids?
Each of our teachers are receiving a kit, and I'm not saying that teachers are the ones wiping down, but certainly we have made sure that those supplies are not dangerous to our students. And at that level, I would not think it unreasonable, although I'm going out on a limb here as far as the safety plan goes, but I do know for the teachers to hand those wipes to a student, or for the students to get past those wipes out and wipe down the desk before they leave. I don't think that is.
That is the expectation.
Okay, and I'm looking at a high school principal.
Okay, so I have to hope that my kid comes behind a meticulously cleaning kid who just does the one wipe. I mean, I have 20-something-year-olds. I would not want to go behind them in this scenario. So we're talking about, 12 years and up, 12 years old, was the middle school 12 years and up,
right?
That we're going to trust a kid cleans that desk and that screen or whatever you're calling those before the next person comes in.
Go ahead, Paul.
Hi, this is Paul Narig. At the secondary level, the other aspect to that sanitizing or cleaning plan that we've discussed and has been shared with parents in meetings and will obviously be shared with our staff as part of their training during the pre-planning, is that not only the students that are leaving the classroom as the class ends for cleaning up their area, but then as students arrive, also area to their comfort level before beginning that class period. So we definitely want those students to have that sense of safety, as well as the teacher. So it's not mandated, but it's not prohibited either.
And so parents were okay with that?
Well, the ones that we've talked to so far that have chosen the brick and mortar option.
And so I just would think that there would be some kind of concern about, students taking, I don't know what kind of wipes you've purchased, but.
Well, okay, so here's what we want to go. If students are going to do it, then that's up to y'all. We have nothing there. But as for teachers doing it, that's encroaching on learning time, especially in that age group. That's coveted time. So we're talking about time to clean when we come in, time to clean when we're about to leave. So that's a minimum right there, in my opinion, of 5 to 6 minutes of learning time lost of every class. I'm just thinking about, we just need to put out there that we don't believe the teachers need to be cleaning these surfaces or cleaning anything for that matter. What about the desks? Will they take everything from inside them with them? Is that a normal situation? Are they going to be using their lockers? So when they change classes, is everybody going to their locker like a normal day of changing classes in high school? Or are we all going to be walking in line 6 foot apart, all in the same direction? No one goes to a locker and you go straight to your next class?
Well, I'd like to try to address those points one at a time if I could. The first one you asked about the desks. Typically in a high school setting, the students don't have desks that you keep materials inside of. There are just flat desks that are integrated chairs or tabletops. At how we set up the classroom spacing to allow for that distancing. Even if a teacher has tables, in the room to put their materials, they typically carry backpacks, so they're self-contained. Each student has their own materials, and the lockers actually was a topic of conversation at yesterday's discussing what our protocol will be going forward regarding the lockers. And so, what we will be doing is making sure that locker assignments allow students to have a locker. And that varies by school. Some schools have a very high participation rate with students using lockers. Other schools, very few students. They prefer to carry their materials with them, and we choose very few lockers. But for those schools that have a high participation rate of lockers, they're going to pre-mark lockers and space them out around the campus. And then also as part of the traffic plan, as the students go, through the hallways, there will be different areas, where some students will have lockers in one area, other students will have they can to space them out. But no, I have a difficult time imagining high school students marching, going from one class to another, especially because every student's schedule is unique. We tailor each student's schedule to what their graduation plan is, what their needs are, their IEP accommodations. So it's definitely not going to be a cookie cutter approach. It's going to be based more on each individual student and where they need to go next for their class. But as far as encouraging traffic direction, from once campus advisors and administrators out, monitoring the students and encouraging them to keep their distance, all the signage, stickers on the floor, every given, we're going to be employing.
So how many campus advisors and administrators are there on a school, in a school?
Varies from school to school.
5, 50?
It varies.
It varies.
Less than 10, more than 10?
At Pine Ridge, we have 4 campus advisors assigned to us.
Okay, so let me stop right there. So you have 4 campus advisors that you're going to have out there making sure that kids try to socially distance in a high school. The teachers can't go out and help because they've got to sanitize and make sure kids are sanitizing and prepare for the next group to come in. So I don't feel like this has been thought out very well at the high school level for certain. And I'm really wondering if the parents got this vision as well, because I'm envisioning nothing's changed. It doesn't sound like anything's changed. Let me ask you, how many kids are going to be in the classroom?
So Tracy, I just want to address what you said before we move on. Can we do that?
Sure.
I don't want to not answer your question, so I'm going to hold that, but I do want to address what you said, because what you said was that means there's 4 people supervising class change, and that is not the case, nor has it ever. Us campus advisors who supervise class change. We have principals, we have assistant principals, some teachers who have gone out and supervised classrooms within. Now I hear what you're saying, the sanitizing classrooms in between, and that's a schedule that we're working on. But to say that it is their sole responsibility of the campus advisors to be the one supervising, that's not accurate.
Okay, so we are going to ask teachers to stand in the hall, which we know are not, we've already admitted that they're not going to be 6 feet apart.
No.
So we're going to have teachers out there, and the kids aren't going to be 6 feet apart, and they also are going to have to try to help manage the flow of traffic. So we've put them in another compromising position. But I think how many kids are going to be in a classroom probably is a good place to start. Are we not doing CDC 6 feet?
In the class, again, I'm going to go back to our earlier conversation. How many kids are going to be in a classroom? At this point, we don't know. It's going to vary, because back to our earlier conversation, until we have those solid numbers, I can't tell you how many kids are going to be exactly. I can't say that there will be no more than 10.5 kids in a classroom. I can say that we will certainly, absolutely not exceed class as it is given, and we are going to make every effort to make those class sizes small. But if you're looking for a finite number, I don't have
So
that.
what is, if I could just ask a quick question, what is the class size for non-core and secondary? So it's unlimited?
Yes,
For allocations.
yes, for allocation
no.
purposes.
So what I hear, what I'm understanding then is there is no cap, if you will, for non-core and secondary.
Correct.
Okay.
From DOE.
From
DOE's
DOE.
perspective, for
We
funding.
have an allocation formula that we use as a district.
Correct.
But there is not one
But
from.
that
So then
allocation is
what's
the
that
same one
number?
you've used in the past, right? That allocation that you're talking about is the same one you've used in the past. So we went into a new plan trying to keep kids and teachers safe, and not any part of that plan included a minimum, or excuse me, a maximum number in a classroom based on the square footage of that classroom. That was not entered into any of this discussion.
Correct. That's
Is
why
there
we give them options.
And so when will that discussion occur? Because that seems it would be a critical piece of information to have when we're formulating these plans. And I just wonder how our administrators like Mr. Narig, Dr. Narig, are moving forward with their discussions at the school sites without having this information. Kind of like flying a plane with one eye closed, maybe.
Well, the numbers dictate that. So, I mean, and so in a huge regard, you're correct. We are, because we don't know. And like I said, very bluntly and honestly at the beginning, until we know who walks through that door, we won't know. But what we do know is that there will be less students on each campus. And we have gone through to analyze those numbers. Right now, the allocations have remained the same. So we know we're going to have less students on each campus. And right now we have the same number of allocations. Now, that's not to say that we're going to, again, like I said, we're going to overstaff or understaff at this point. We're just not ready. We don't have those numbers.
And that's why, for me, I'll go back to what I was saying before. If we had some agreed upon structures moving forward, when these numbers start to come in, then I think it would be helpful to administrators to make those plans. But with parameters, it just seems like it's just kind of all over the place, and we don't know what to expect from any school.
Well, I also want to point out something that I don't think we've talked about or has been brought up yet, and that is that social distancing is not the only protective measure that we're using within our classrooms and on our campuses. We also have the shields available. We have masks. We have the face shields, and we have the plexiglass plastic barriers as well. So that's not, social distancing is measures that we're using, but it's not the only one.
So
I want to read what the CDC has on there. It says the CDC says a person should quarantine if they were in contact with someone who tested positive for more than 15 minutes within 6 feet and have come in contact with respiratory and may. So of the three right there that the CDC is saying are when a person should quarantine, tells me that you may have people having to quarantine on a daily basis because of this within 6 feet by itself. We're not even trying to go into a scenario at the secondary level that keeps people 6 feet apart. And I understand it's hard, but I don't mean to sound crass, but that's why you guys get paid the big bucks to make it happen. Please let me finish.
Okay, go ahead.
So we have within 6 feet, and that's not going to happen. So already we've killed two of the three requirements for a person quarantining if they've been around someone who's positive. Okay.
Well, what I was saying was I don't want you to put words in my mouth either. I didn't say we're not doing 6 feet. No, I never.
Your principal did.
That is not what I'm saying. I didn't hear him say we're not doing 6 feet. And I'm saying, he is saying, what we are saying is that we're providing equipment that would prevent that personal protective equipment above just the regular face mask. So no one said that. We have hundreds and hundreds of classrooms throughout our district that are all different shapes and sizes, and I'm not in those to make that call right now as far as numbers. And I think what trying to commit to say what could be 6 feet with 15 kids in one room and another room, it might, and if we put that number out there, then that is what we're stuck with.
And you're right, Rachel, we can't be in every classroom. But we had a discussion yesterday, a little bit about, we suggested that the in those classrooms be the folks that identify when a situation is occurring that they deem to be dangerous or unsafe. And we had to have a conversation about that. And there was some conversation about, well, how are we going to know if it's based on emotion or if it's real? So you and I and our teams can't be everywhere across the district. We had a conversation yesterday about the ability of the professionals to determine appropriately if a situation was or was not dangerous, and conversation about the challenges of just putting out some very basic standards and expectations in our schools. I think this whole line of conversation supports the need for those standards. Similarly, needs those same standards as well. It's a protective, proactive step to ensure that because right this moment on August 4th, we are potentially going back brick and mortar, that we have these safety measures put in place. Now, if something changes, work remotely, well, then this conversation happens later when we do go back to brick and mortar. But because in this particular moment, this is the mindset, we haven't heard otherwise, We have to have these conversations.
So we'll send that. We have in writing some safety measures that we'd like to send over to you so that you can review those.
You want to share your screen and we can go over them and then you can
No,
send.
I don't have them here within the plan that we want to share with you to review.
Within the plan, the board?
Yes.
Plan, yeah.
Mhm.
Okay, so we looked at all of that stuff. Are you talking where the desks were moved and there were the?
We're talking about all the safety
All of the
precautions that will
safety-
have in place. Correct.
Okay, well, there was nothing in that plan that makes me feel any safer today than I did in April or May about going into those. I mean, I know that you've bought masks and I know we're talking about shields. I've seen them. I put one on at the board meeting and
I wasn't actually
and
talking
all
about the plexiglass barriers, but the face shield.
yeah, I mean, I've seen those pictures too, but that doesn't make me feel more confident about the environment being conducive to maintaining my health and safety. And that's why we're trying to get these very basic under live. Okay.
Which
I see you're on now, Mr. West. You want to
No.
say something?
Yes, ma'am. I didn't want to interrupt you, though. I just wanted to say, which is the whole idea of making sure that we have a plan in place that's going to provide safety, safe as we possibly can conditions for our students and our employees. Okay. And so that's one aspect of the plan, and that's very important that we make sure we're doing that and saying that, and that we are following the CDC guidelines. We're providing every safety measure possible. It's requiring us to open our schools, and that's the point that we can debate all day long. And I hear what Tracy's saying along those lines. But it kind of goes back to your aspect of whether individuals feel safe. Much of what we've said and we've talked about is very much and personal responsibility of wearing masks, and this hits on so many factors of responsibilities, which is why everybody has a different feel of what that means. You're saying you don't think that it's safe enough to return to schools. So, and I mean, we can argue all day long about that, but the fact of the matter is that we've been directed that we have to, and we're going to put every safety measure in place that we possibly can't feasibly put in place to do so. Now, when you're talking about Volusia Live, if the safety aspect is the key there, that's why we put Volusia Live in place. It's the opportunity to be at home if they need to. And so by pushing back and saying we can't do Volusia Live or it's something that's not a feasible, and that's a concern because that's actually butting up against. So
You misunderstood.
we're trying to work in the parameters that we have. It's a tough situation for everybody. And we're willing to obviously collaborate with you and talk to you about what we can do and put those in place. At elementary, we feel like it's feasible to do that Volusia Live and have a designated person, and it may not be in every single circumstance. Rachel brought that up. At secondary, there are so many factors that are involved in that, including kids coming in and out. And I recognize we're trying to do something very specific and nail it down, but I don't think there's any way possible we're going to be able to do that with the fluidity of our kids coming in and out. So I kind of said a lot of things, but I kind of feel like that we've got to come to a point. Safety is the most important thing of our students and our employees. And we're doing everything possible to do so to move forward with that. Okay.
I need to respond to something that you said. You
Okay,
said that
can I
we
just
are
finish
following the
my thought?
CDC
Can I
guidelines,
finish
okay?
my train of thought?
Oh, I'm sorry. I thought you were finished.
Sorry, I was wrapping up. I tend to go a little bit too much there sometimes, Tracy, but I just wanted to say that the bottom line is that we all know that we're in a situation to do this, and we've come before you and wanted to talk to you about and be collaborative with you on these kinds of things, but we have to kind of, within the contract and the collective bargaining agreement and the terms and conditions and the job requirements that we have set forth and in place right now, which by the way, we will follow through. We have to have a plan to move forward. Every other district in our state is having a plan and following through on this as well. We want to do the same thing. We want to make sure our teachers are safe. We want them to show up on, it's going to be next week for them for pre-planning. We've given them, we're fortunate that we have a calendar that we're coming in a little later than some of the other districts that have already started. They've already started their pre-planning. They've already started their training along these lines. We're fortunate we're able to learn some of the things from them and be able to implement that. Our kids are going to be starting later than they are, which is a good thing. We're going to once again be able to learn from them as well. So I just wanted to wrap that up. So Tracy, thank you for letting me finish with that. So go ahead.
So one of the things you said is we will be following CDC guidelines, but in the previous conversation that I just had, you're not following CDC guidelines because you're not requiring people to be 6 feet apart and you do not have a maximum number that's going in a classroom. I mean, that is an easy guideline. You could have simply got the square footage of the classrooms and from the fire, from your any of your facilities people would know these things. So we needed a maximum number of kids to make that happen. So to say you're following the CDC guidelines is true. So the second thing I want to ask is, so let's go to the next thing, and that is masks. What happens when a student refuses to wear a mask?
We're in conversation right now. Our board is having conversation about when a student refuses to wear a mask. Mr. Penley presented policy 503, which is the face mask policy, which was approved by the board. And that policy was written as a health emergency. So there was not disciplinary actions taken into account. However, we know that our board is reconvening to discuss that right now. So we'll have that answer for you soon.
There was something I wanted to follow up on based on one of the things Mr. West said. Tracy, are you still working through your list of questions, or could I jump in?
Go right ahead.
Okay, so Mr. West, you made a statement about following the plan that you've been directed by the state to follow. I'm going to push back on that a little bit, because as we look around, and you also mentioned learning from other districts, we look around to other districts, we see that other districts are in fact opening, and they have made conscious decisions to actually do what you suggested that Volusia County is trying to do, which is prioritize the health and safety of not only teachers, but support professionals, administrators out there who on the inside are probably very fearful about returning to brick and mortar, because they're like every other human being out on the planet. They have perhaps, and they're worried about their families too. But right now in Volusia County, there has been very little conversation about actually taking a look at what's going on around us and making the decision about, is brick and mortar safe at this time to return? We're not having that trying to work out the mechanics of returning face to face. But our position is we want to return to face, but when it's safe. Harem scarum, we're going to try to put a square peg in a round hole, because we believe that's what the governor is mandating us to do, when we know that other districts have taken a stand and decided not to do that. And I know at this table, you are not in the position to vote that up or down. But I think that at this table, you are in the position to have a conversation with those who will make the decisions, and perhaps have some real conversations about what we're facing. So I also want to just point out that, Mr. West, you talked about Volusia Live is in place to keep kids safe and learning remotely.
And employees, I said, and employees.
Well, how is Volusia Live going to keep the employees safe if we're requiring them to come into the facility to do it? When we're asking them to come in the facility to do that, we're taking up space that could otherwise be used to socially distance. So I know we're getting, but I think these things are some of these barriers that we have haven't really talked at any length that are inhibiting us from doing the other work.
I do think that by offering that option and having a number of students keep that connection with their brick and mortar school, and allowing the teachers, because they're keeping that connection with their brick and mortar school, to stay on the campus, then that's less kids within the building, which is safer than having all the students return.
Okay, so if I have 500 kids at my school and 450 show up, yep, there are less kids in there. Absolutely, there are less kids there. So, but what happens in each classroom? If I don't have a max number to know how many kids are going to be the cap in my classroom, although there are less kids on the campus, maybe fourth grade has everybody back 100%. And then what are we going to do? And I know you don't have those numbers, Rachel. I know you don't have them. But that's why, again, I think that we should have those discussions now about what the expectations are when the numbers come in, and then provide the structure for our teams at the schools to work through. And I think without those fundamental structures in place, it's like building a house without any footers. If we try to build a house without a foundation, the house is going to crumble. And when we bring our kids back into our schools, you know, because that's the route we're going right now, we can't afford to have the house crumble. This is we have to get it right the first time kind of situation, because if we don't, people are going to get hurt. People are going to get sick, and we can't walk that back once it happens. So I have the district reopening plan pulled up. Do you want to look at some of these safety precautions, or are we just past that route?
We can look at them if you, sure.
I mean, is that the best use of the few minutes we have left?
I'm going to leave that up to you as far as what else there is to cover today, or what you want us to respond, but we're happy to do that if that is for you all.
No, it's not really, because I'm not confident in these. I just know, don't take it personal, nothing is personal, but I'm just not confident in what's been articulated in the reopening plan that it's really going to work to keep people safe. And I can just, and then I wonder too, like where some of these things came from. Did, you know, where did some of these best practices come from? Were they pulled from were they pulled from the Department of Health? Were they just things that we thought sounded good? I mean, how did we come up with it?
The Department of Health was involved, of course, in writing the plan. So my question then of you, I guess, if you don't want to review them, and maybe it's I don't know what you're saying, if you don't want to review them right now, or if you just don't want to review them, then are you going to submit language within the MOU to us to review so that would address the concerns within that, or are we just leaving the topic? I'm not sure.
Yeah, I'm not saying that they are not worthy of review and discussion. I don't know that we're really at that point. We have 12 minutes left, right? So, okay. But what I did ask though, where these items came from, how we landed on these in particular. I know in the past I've asked about the definitions that were included in the common language slide. I'm looking at slide 56 out of the 66, like where those definitions came from. Just a couple questions like that.
Okay.
All
You
right.
want me to get you answers to those questions and bring them back next time?
Sure. And then could you also maybe have a conversation with your team about what a reasonable cap in secondary would be for core and non-core?
Okay.
I mean, I think there should be some identification of a number, regardless of what comes back from the survey, right? Okay. We should have, that should be a standard practice. Like that's some of the things that we're asking for. What else? I will take the documents that were sent to me from the teachers and support staff who worked on middle school and high school, and I will send you what they've sent in, so you could take a look at some of those suggestions if you still want to do that.
Great.
Okay. Okay. And I think that when I'm sorry, go ahead.
Oh, I'm sorry. We were just looking at timelines to that retirement incentive language to you by Thursday.
Thank you. Okay. And then I think what we will do is we'll go ahead and as a team, we'll go through what was on here as far as health and safety, and then we'll come back and we'll have some proposed language for you.
That was
under health.
great. I think that will help a lot. I mean, I know that the discussion helps, but it's much more concrete when we have it in language and can look at the feasibility of it.
Right. And then what I'd also like to ask that we start to consider it, and I'm not going to be able to have it prepared for Thursday, and I doubt that you will too. We've got NTO tomorrow all day and board meeting in a couple minutes. So what I'd like us to do, because we're going to need to continue bargaining into next week. So I'd like to maybe set some dates and times, but start to actually present some language on teaching and learning expectations and some of those other subcategories that will be encompassed. Okay. Do you want to look at calendars for the week of the 11th, 10th?
Everybody got your calendars up?
I do.
Okay. We're ready.
Gotta get my calendar. All right, well, looks like I'm wide open all day.
So I campus on Monday.
Yeah, new teachers are on campus. Afternoon, maybe?
Monday afternoon?
You've got stuff on your calendar. I'm in a meeting with Dr.
Okay, so 2 to 5?
How much your meeting?
4.
We have, a couple of us have meetings at 4.
But if we did, could we even back it up
1:30?
3:30?
to, oh, you have a working lunch there.
No. That's us. We can undo it.
1:30 to 3:30?
That's all we can do? Can we do? I know we don't want to do back-to-back meetings, but we've got to start cranking through some of this stuff. Time's evaporating.
From 12.
12:30?
12:30 to 3:30?
Okay.
Sure. Yep.
Okay.
Okay, so Monday the 10th, 12:30 to 3:30. Okay, now Tuesday is the first day of pre-planning, and on my calendar, it looks like there's a board meeting.
Right.
What time?
I'm visiting schools.
What time is that board meeting?
It is at 10? It is at 10.
So they're having 2 back-to-back 10 o'clock meetings?
It
Wow.
would appear so.
Yeah.
So,
I know you guys can't say what I can say. So anyway, so we don't know how long that's going to go. So we would need to do it.
and with that being, can I just ask, with that being our teacher's first day back,
Yeah.
most out at schools and on campuses and actually doing the first day of school. I have my principals looking at me like, so Tuesday would not be a good day for us.
Well, I just bring that up because we have team members who are actually supposed to be on campus, that day. So we're going to have to figure out that as well, how we convene our teams going forward. I guess we'll just use release time still. All right, so Wednesday the 12th. Can we do another 3 hours on Wednesday the 12th?
Or more.
Yeah, or more.
Maybe we go 1 until on that one.
Hold on one second. We're checking on starting to gear back up pretty quickly.
So the 12th is the whole day, or?
Hold on.
Elizabeth would like to propose on Wednesday, the 12th from 3 p.m. on.
I'll just be in that principal meeting.
Okay.
Can we start earlier than 3?
We cannot start earlier than 3, but we can stay for as long as needed.
Okay. What about the 13th?
We can look at the 13th, but then I think we probably need to see where we are.
Well, I'd kind of like to put something on the books just to secure the calendar, and then if we don't use it, we can cancel it rather than scramble to try to put something on if we don't. Thursday, I'd like to propose 12:30, starting at 12:30 and working till at least 4.
We can't do it.
That one. Sorry.
You're here at 2:30.
Yeah, 12:30 to 2:30, but we got 3.
Oh, you have a 3 o'clock. Okay.
12:30 to 2:30.
12:30 to 2:30.
I really don't think that's going to be enough time.
Okay.
What if we?
Then let's look at Friday as well then.
Yeah,
Mhm.
listen, I want to make sure that you understand the sense of urgency that we have to get this done for our bargaining unit members. Because at the end of this week, we're already at this out. We can't dilly-dally.
We agree. We have 2 open-ended dates coming up. And so, but at this first week back with teachers, our team is out in schools.
Well, my team is teachers, right? I've got my staff here, but my team are teachers and support professionals. So I'm dealing with that too, but this is the priority to get the work done.
Okay.
And so
as well.
I heard you and I agreed to, what I'd like to do is just finish the thought here.
Yep.
Is that, and another piece of this puzzle going to actually be convening at the school sites for face-to-face pre-planning while we're trying to work out this mechanism.
And I have to say that we will be sending them back under the direction that we are to abide by the contract as it stands now, and the job descriptions as they stand now. So until we get this hashed out, we're living by the CBA as it is, and the job descriptions and the practices as they are.
We
Right.
agree.
Right.
We agree to that.
All right, so 12:30 to 4 on Thursday.
No.
No.
12:30
No,
to 2:30.
our team
2:30 to 12:30 to
12:30
2:30.
to 2:30.
And we'll look at Friday also to see what's available Friday.
And then I'm not getting to take any. All right, Trudy.
On Thursday, is that what you said? 12:30 to 2:30
That's
on
what you
Thursday?
offered, right? 12:30 to
Correct.
2:30.
Yes, and then
So I'm
Friday.
You.
Okay, Friday.
Let's start in the morning. What about 10? Let's go 10 till, well, that's at least 10 till 1, late lunch. Or we could do 12:30 on.
10 till 1. Yep.
And if we don't finish on Friday, the 14th at 1, is there an opportunity to have a break and then maybe reconvene for a little bit in the afternoon if we need it?
Right.
So a tentative, maybe 3 to 5, also on Friday?
I can't commit to that right now, Elizabeth, but we'll look and see what we've got on that Thursday, on Friday, 10 to 1.
So we won't see you tomorrow, but we will see you Thursday at 1:30, and we will discuss the retirement incentive counter. We will be bringing some things forward for health and safety, and I will send to you the information received from the middle school and high school work groups that we put together.
All right, and also by then, we are work counter on your latest leave proposal, so we will work through that.
Okay, so that's a nice little agenda that we've got. Okay. Okay, well, thank you guys, and I imagine I'll see you at the board meeting in a
Okay,
few
see you
minutes.
there.
All right, thank you. Bye-bye. So go to the breakout room for just a moment, team.